hand. How is the development, the latest of the developments with Khalid Mohsen Shairi? And tell us as well as to what is your plan for his treatment.
Okay, upon arrival, as has been mentioned with maybe your team there, we started putting a plan for Khalid, and it is in 4 stages. The first stage is completed by his transfer. The second stage is evaluation and investigations and finding out any acute and active problems. And third stage is to start correcting these problems that might be discovered during assessment. And within that stage, there will be the introduction of weight reduction diets, special diet in these cases that will help to reduce weight in an acute manner, especially the visceral fat and the fat around the liver and around the organs. And the last stage will be, this stage, the dietary stage is in different levels, acute one and then gradual one, and then it has a different maintenance part. And the last stage, as I said, will be a surgical intervention that will be decided based on the success of the other weight management non-surgical program that will be introduced. So these are the situation. Currently, he's in a good condition. He has what we call it sleep apnea, and that is overcome by giving some high pressure support that will give some, will push the air in his airways, so that will expand his lungs. There are other maneuvers that we are doing to help him, and most importantly, the physiotherapy, rehabilitations, because somebody who's sitting in his room for even 4 weeks or 6 weeks will lose the muscle strength. What about somebody who's really there in the bed for 3 years or more? So sure, that needs a lot of effort and a lot of work. Dietary programs is important, and these are the issues that are currently we are working on to improve Khalid's status and eventually to reduce his weight.
Mm-hmm. Yeah, and Dr. Ayedh, as we're talking about these different stages, is there a certain target, a certain plan to reach maybe a certain weight through these surgeries, and how long would they take, all the stages, and how successful they would be? Is there a high percentage of success?
Usually we expect the first stage, which is the acute one, is about 2 to 4 weeks. And afterward will be followed by a maintenance stage where we continue with reduction, maybe from 1 month to 6 months. And it has been shown in many studies that it will improve the weight reduction in a safe manner. Now, whether we will do the surgery in that stage or not, that depends on the improvement and the general assessment from all multidisciplinary teams that are evaluating the patient. But we expect the first stage to take from 1 month to 6 months. And afterwards will be the surgical or other intervention that might be carried out after that. However, does not preclude doing the surgery intervention earlier.
So the surgery cannot be decided until the second stage, right after the second. The surgeries would be decided after maybe 2 or 3 months on average.
That might be, even the first month definitely will be determined factors in deciding the surgery or not. Well, that depends on the conditions and the investigation we are doing now, and his tolerance to whatever procedure, and the weight reduction that has happened during this month. So if these are really in the maximum state, then sure, we might consider surgery at that time. If they are not, no, we'll continue more.
Indeed. But Dr. Ayedh, with all the experience that you have accumulated over all these years, being involved with so many of the cases, so many of the surgeries that you have done, with all the professional experience that you have, how optimistic are you about the case of Khalid?
Let me increase the difficulties more and more, because this patient had what we call it total pancreatectomy, which means he has major scars in his abdomen from right to left, through which the surgeon went in the first year of life behind the stomach to remove the pancreas. Now, if we go to his abdomen, we are going to a jungle with the all adhesions and all the previous scars, and so that's another difficulty. However, I'm very optimistic with doing this case properly, and we have different 2 options or 3 options that we can offer, but I am very optimistic.
Very nice. Dr. Ayedh Al-Qhatani would like to thank you very much, actually, for joining us today.
And we wish you all the very, very best.
Thank you.
Thanks a lot. And that was Dr. Ayedh. He was talking about the different stages that Khalid would be going through. And until now it's undecided because they still taking some exams in order to know the case exactly and to decide the needed surgeries for him. He said the most difficult part is that he's having so much problems in the pancreas area, and this is the biggest challenge for Dr. Khalid and his team. May Allah help them and bless them all. But as we're talking about the transporting, Mr. Khalid, transporting him from Jizan to Riyadh. Now all the equipments are in King Fahd Medical City. There is nothing needed to transport him again to maybe another hospital outside the country. He's going to stay there all the time?
It is early to decide this part of the treatment, and I think after fully assess Khalid with the lab and some maybe radiological test for him, after that we may with the medical team to decide if it's continue with the same plan or if anything will be changed.
Indeed. And with this, Dr. Badr Al-Taibi would like to thank you so much for joining us in today's edition of the program, and we wish you all the very, very best as well on this case particularly. And with this also, Dr. Anne Blondin would like to thank you for joining us here in the program.
It's a pleasure.
And Dr. Anne, once again, as we are concluding this particular part, just very briefly, how optimistic are you? Being associated with the nursing department, how optimistic are you regarding Khalid's case?
Well, with the great multidisciplinary team that we have, we all hope, inshallah, that everything will turn out well.
Inshallah.
Inshallah.
Inshallah. And our dear viewers, for now, actually, we'll stop in our economy report to see the updates in the economy world, and we'll be back to you. Stay tuned.